Thank you for the introduction. My name is Manon Dorstorst. These are my disclosures. We all know that a lot of people suffer from OAB, and among women this is about 12.8%, and in men 10.8%. Ptns is a form of minimal invasive neuromodulation, and it reduces the complaints of patients of OAB by 60 to 80%, according to the literature. However, we don't know yet a lot about Ptns, and we don't as well know not a lot about Ptns and neurogenic patients in a long-term follow-up. So what we did in our hospital, that we did a retrospective study. We included all patients who had Ptns during January 2008 to July 2018 with a neurogenic bladder. As controls, we used patients who had in the same time period Ptns, but didn't have a neurogenic bladder, but with other reasons of OAB. We asked the neurologist of our hospital to score the neurological status of the patients by validated scoring systems, pre and post Ptns. And as we used Kaplan-Meier curves to estimate the survival of the treatment, of the Ptns treatment, to look if it's a rule or not. For the PAR-TEAS test was used pre and post Ptns to check out if there's a deterioration of the neurological scores, and our results were as follows. We included 55 patients with a neurogenic bladder and had 347 controls. 53% of the patients were female and with a mean age of 64 years. This was our neurologic group. There are three main categories: MS, post-stroke, and Parkinson's disease. Baseline scores by the neurologist were as follows, and as you can see there, when patients started the Ptns, they had mild symptoms of their disease, and they did not significantly differ after quitting or the time span. 53% of our group continued to maintenance Ptns, which said that they continue after 12 weeks of treatment. These are the Kaplan-Meier curves. On the left side, you see in green the non-neurogenic group, and in blue the neurogenic group. We had a maximum follow-up of 69 months. On the right side, we purified the group a bit more, so we excluded patients who did not continue to maintenance Ptns, and we excluded the patients who had a good response to Ptns, but they had to quit because of non-medical reasons, like moving houses, debts, or something else. Which we had a medium follow-up in the neurogenic group of 34 months, and in the non-neurogenic group of 46 months. So our conclusions are that successful treatment does not significantly differ in outcome, neurogenic versus non-neurogenic patients. And we know that we have a selected neurological group of patients, but they could benefit from Ptns in the treatment of OAB. Thank you for your attention.
Yes, Howard.
Just curious, when you defined a non-successful treatment, how many weeks of treatment did you give them before you said they were not successful?
What we did is that after 12 weeks, there was a consultation with their urologist, like, did you have a benefit or not? And if they were telling like, no, I don't feel anything, then they quit. And during the Ptns, they also had follow-up visits. And when the patient said like, no, I don't feel anything more, then they quit. It's subjective.
And were all the patients treated in hospital?
Yeah.
Or they didn't do home treatment?
No, that when they went to TENS.
Yeah, then they did home treatment with TENS.
Yeah, but then we excluded because they were initial good responders, but quit percutaneously because of other reasons.
Yeah. Any other questions or comments? Well, thank you very much.